Okay, I'm Callie. I'm going to be doing my head to toe video for my assessment class in 113. It is Tuesday afternoon, 1:58 is the time, and I will get started. Knock knock. Hi, I'm Callie. I'm going to be doing a head to toe assessment on you today. I'm going to provide privacy. Wash my hands. How are you?
Good.
Can I get you to state your name and date of birth for me?
Kate Lee, June 5th, 2012.
Okay, let me check your armband. Okay, perfect. I have a pen and a Post-it in case I need to write down anything that I find during the assessment. So, do you know what day it is today?
Tuesday.
Oh yeah, do you know where you're at?
Home.
And what are we doing right now?
We are doing a video.
Good, yeah, good. So are you feeling okay today?
Yeah.
Okay. Do you have any pain?
No.
No pain? Okay, that's good to hear. Okay, I'm going to step back. She is a female Caucasian child, 8 years old. She is relaxed and sitting up. She's affable, friendly. She's smiling. Her speech is clear. She is ready to proceed. I don't see any pain, signs of pain. Okay, Kate, are you able to walk around by yourself? Or do you need a cane or a wheelchair or anything?
Walk around by myself.
Okay, so there's no mobility issues. She's independent. Okay, is it okay if we get started?
Yeah.
Okay, so I'm gonna start with your looking at your head and hair and eyes and stuff. And is it okay if I touch you with my hands?
Yeah.
They're clean, okay. So I'm gonna start by looking at the skin on your head, checking your, lean forward a little bit, good job. Okay, so your face is warm and the skin is dry and intact. I don't see any bruises or lacerations. Your features are symmetrical. Your hair is blonde and I don't see any hair loss or anything going on there. Okay, so I'm going to take a look at your eyes. You can just look straight at me. I'm just going to shine a little light in them. Good job. So do you wear any glasses, Kate?
No.
Okay, take a look at this. Good. Have you had any changes in your vision recently? No? Okay. So Perlawa's pupils were equal, round, reactive to light and accommodation. There's no changes in vision. She does not wear glasses. I'm going to take a look at the white parts of your eyes. So her sclera is white and conjunctiva is moist and pink. Okay, I'm going to look at your ears now. So look at this one. Back behind the ear. This looks good. There's no drainage or wax coming out of it. Okay, let me check this side. Do you hear okay? Do you use hearing aids?
I hear okay.
Have you had any changes in your hearing?
No.
Okay, yeah, there was no wax or drainage out of that ear either. And you don't use hearing aids, do you?
No.
Or do you use them? You don't? No? Okay. Good. So I'm gonna look up your nose. So you want to tip your head back a little bit? Okay, her her nasal mucosa is pink and moist, and there doesn't look like any congestion or draining. Have you had any changes in smell?
No.
No changes in smell? And do you have a snuffy nose or
No.
runny nose or anything? Okay. Now can I get you to open your mouth? And take a look in your mouth. The mucosa is pink and moist. Her tongue is rough and pink and moist. Your teeth look good. Are they your real teeth or are they dentures or they're your teeth?
Real.
Okay. What about swallowing? Do you have any trouble swallowing? No. Okay. And what about taste? Do you have any trouble with tasting?
No.
No trouble with taste. Okay. I'm gonna have you do a little bit. Do you have any pain in your neck?
No.
Okay, I'm gonna feel your neck here. Okay, let me check the back. Thank you. So there's no masses or bruises or cuts. So I'm gonna have you do a couple exercises for me. Can you look up and down and side to side? Good job. Do you have any pain doing any of those?
No.
Okay. So your range of motion is good. I'm going to check your turgor. There's no tenting, so you're nice and hydrated. There's no bruises on your neck, and the skin looks good. So, okay, Kate, I'm going to have you, can you lay down for me? And I'm going to listen to some lungs and your heart and stuff. Okay, is that okay?
Yes.
Okay. So I'm going to look at your chest. So chest is symmetrical. AP ratio is 1 to 2. There's costal angle is less than 90. So yeah, it's warm, dry, and intact. Okay, I'm going to listen to your lungs, and I want you to breathe through your mouth while I listen. Okay, I'm going to listen to 4 pairs on the front, and then I'm going to listen to them on your back. Okay?
Okay.
So you just breathe through your mouth while I listen. Okay, good job. Now I'm going to have you sit up so I can finish listening on your back. So we're going to listen to 5 pairs on your back, and you can just keep breathing through your mouth. Okay, good job, Kate. So lungs are clear bilaterally. Respiration rate is 16 breaths per minute. I'm going to write that one down. So your breathing was regular, in depth. So respirations were 16. Okay, I'm going to listen to your heart.
Should I lay down?
Yeah, that would be good. Yeah, you could lay down. Okay. So I'm going to listen to a couple spots and get a heart. So I'm going to start on the right side at the second intercostal for the aortic valve. And that is where S2 is loudest. Then I'm going to the left side at the second intercostal for the pulmonic valve, and S2 is the loudest. Then we're going to go to the third intercostal, which is Erb's point, and S2 and S1 are equal. Then we're going to go to the fourth intercostal, the tricuspid valve, and S1 is louder. And then we're going to go to the fifth intercostal at the midclavicular line. And this is the the mitral valve, and it's the point of maximum impulse, and S1 is loudest, and this is where they get an apical pulse. So I'm going to take a pulse rate. Okay, so I got an apical pulse of 78 beats per minute, and they use that spot if they're gonna give heart medication sometimes, or, okay, yeah, you can do that. So I'm gonna write down your heart. Heart rate is 78. Okay. Kate, I'm gonna take a look at your belly. Do you have any pain in your belly?
No.
Okay. So I'm just gonna look. So abdomen is flat and symmetrical. There's no obvious lumps or masses. So I'm gonna take a listen to your bowel sounds, starting at the lower right quadrant. Move up to the upper right quadrant. And finish off at the lower left. Okay. One thing I would have done is raise the bed up to work, but since you're on the couch, can't do that. But I would raise it up so I wouldn't be bending over you. But your bowel sounds are normal active bowel sounds, so that's good. Oh, actually, is it okay if I touch your belly?
Yeah.
Okay, so the skin is warm, dry, and intact, and I'm just gonna palpate in each quadrant. Okay, move up to this one. Okay. Okay, I want to ask you, do you have any trouble going to the bathroom?
No.
So can you tell me about your last bowel movement? What was it like? Can you describe it?
It was just brown and
Just like how much? Was it like
just normal.
just normal? Oh, okay. And then what about going pee?
It's just yellow and normal.
Yellow and normal. But is it clear or cloudy or
Clear.
It's clear. Oh, okay. Okay, good. So what I'm going to have you do now is sit up for me, and I'm going to take a look at your arms and legs and have you. Good job. Okay. So the upper extremities are symmetrical in muscle tone, and they're warm. Their skin is dry and intact. Your fingers and fingernails, there's no clubbing. A couple little scrapes right there, but probably from. Okay, I want you to grip my fingers for me. Can you squeeze them as hard as you can? Good. So your grip is equal bilaterally. I'm going to check your cap refill. Okay, good. It's less than 3 seconds. Okay. I'm going to check your legs here. We'll just kind of roll these up a little bit. Okay, so yeah, legs are bilaterally, the muscle tone is equal. It is clean, warm, dry, and intact. There's no bruising or lacerations that there's no edema present. Okay, Kate, I'm gonna, actually your feet, let's do your feet. Your toenails, cap refill is less than 3 seconds. I'm gonna check your post-tibial pulse. So those are bilaterally equal. Good, and your digitalis pedis pulses here. Good, those are bilaterally equal, palpable. All 4 were, yeah, 2+. I could feel them nice and good. And that reminds me, I'm gonna check the pulses on the radial pulses on your arms to make sure those are. Yep, those are bilaterally equal too. You can feel those nice and good. Those are, yeah, +2. Okay, so I'm gonna have you I'm gonna put my hands here, and I'm gonna have you pull your feet up towards my hands. Oh, good job. Okay, now I'm gonna do it on the opposite side. So now you push like a gas pedal. Okay, yeah, so strength is bilaterally equal. Okay, Kate, thank you for that. So I am going to go document my stuff. So I'm gonna make sure the bed is lowered and the patient has the call light in case I need anything, they need to get anything. Is there anything I can do for you before I leave?
No.
Okay. So for diabetes, if my patient had diabetes, I would want to check for signs of hypoglycemia. So if there was tremors or sweating or headaches, blurred vision, those would be things I would want to check, assess for. And I also want to assess for tingling or burning sensation in her feet or hands for diabetic neuropathy would be something we would check for. I'd also check for diabetic ulcers on the bottom of her feet. In this area is real common for diabetics to get those. So that would be another assessment point. And I would also want to ask questions about how does she monitor her blood sugars? Does she take insulin for, is it type 1 or type 2? What is her management? How does she manage her diabetes at home? Does she need, is there education I need to provide her? Does she have all the support she needs? Does she have any questions about her diabetes? So those would all be things that I would want to ask and look for in a diabetic patient. Okay, so I'm going to wash my hands before I leave the room. Okay, so now I'm walking over to the computer to do the documentation part. It is 1:16. I am going to be getting logged on here. My computer will cooperate. The camera set up. Let's just keep tipping over, so that's not going to work. Okay, I need the lockdown browser. Okay, video at my screen here. So I am going to, actually it's under quizzes, I think she said. Okay, so I am clicking on the final head to toe documentation, and don't turn it off yet because the Okay, so here goes my it's doing a little test. Come on. Okay. A webcam check. Okay, so yeah, you can turn that video off now.